Welcome to episode 3 of Project Echo for Pediatric Obesity. I'm Jessie Kreiner from Keys for Healthy Kids, and I'm doing your introduction today. Today's episode is entitled Improving Our Kids' Health Through Prescribing Physical Activity, and our guests are from Active Southern West Virginia. If you're joining us live today, please be sure to put your name and email address in the chat box. And with all of that being said, I'm going to go ahead and turn it over to our host with the most, Mirinda.
Hello, everyone. I'm the clinical coordinator for Keys for Healthy Kids. We're really happy you're here today and excited about having Active Southern West Virginia with us. So what we're going to talk about today is improving our kids' health through prescribing physical activity. Our objectives today are going to be to identify current physical activity guidelines for children and how providers can better assist families in increasing physical activity, to understand Active Southern West Virginia's Kids Run Club program and how to get kids involved with it, to understand Active Southern West Virginia's model of using volunteers to lead free programs for kids and adults, and to understand where to find information about Active Southern West Virginia's Kids Run Clubs and free community captain activities. So first of all, I just wanted to start by giving you guys some statistics about our kids' physical activity rates. So first of all, except for increased sports participation among high school female students, overall youth physical activity levels have decreased. The lowest rates of physical activity occur among adolescent girls, children and youth with special health care needs, and youth of minority status, and rates of inactivity increase with age. The typical preschooler spends more than 6 hours per day in sedentary activity and just under 15 minutes per day in moderate to vigorous physical activity. The average 8 to 18-year-old spends more than 7 hours per day in front of a screen. That blew me away. 15.4% of students reported not being physically active for at least 1 hour on a single day in the previous week. All right, so what I'm referencing today is an article that was put out through it's a clinical report from the American Academy of Pediatrics, and it says it's physical activity assessment and counseling in pediatric clinical settings. So that's where I got this questions. It has statistics in it. It goes over information about the importance of addressing physical activity in the clinical setting. So I just wanted to summarize a couple of points from the article, and then we're going to discuss or talk with Active Southern West Virginia. So first, the American Academy of Pediatrics recommends that physical activity be a priority topic starting at 18 months of age. So, we want to start very early emphasizing how important physical activity is for our kids. And they encourage pediatricians to go beyond simply recommending that kids get exercise and take the step of actually issuing a prescription for physical activity, which we're going to talk about later on in the sessions, but I just wanted to go over that. So we already talked about the physical activity guidelines that they recommend for 6 to 17 years of age, that it's 60 minutes of physical activity every day. And they actually say including vigorous intensity as well as muscle and bone strengthening activities at least 3 days per week. For children 3 to 5 years, they recommend that they get 3 hours or more of physical activity per day. And it's not as structured for younger children, it's just they want you to go out and play. All right, so we're gonna turn it over to Active Southern West Virginia. We have India, who is the youth for India Krawczyk, I hope I pronounced her name right, who is the youth program director of Active Southern West Virginia, and Melanie Seiler, who is the executive director of Active Southern West Virginia, and we're really excited about them being here with us today. So can you start out, Melanie, by just kind of telling us about Active Southern West Virginia and what kind of programs are available through your organization?
Sure, happy to. I'm so glad to be here. Active Southern West Virginia is in its 7th year of operations, and our mission is to improve opportunities for physical activity. And with our health education campaigns, we like to utilize the Move Your Way campaign that promotes the physical activity guidelines for Americans. And so the youth recommendation, like you've already mentioned, is 60 minutes of physical activity for youth every day. And that's to include muscle strengthening and bone strengthening activities as well. So I encourage everyone to take a look at the Move Your Way material. It's a great resource. And there's other tools within the Move Your Way campaign. So Active Southern West Virginia has 3 main program areas where we want to deliver programming at the community level, in schools, and in workplaces. So I want to tell you a little bit about each of those. For example, with adults and within the workplace, our workplace wellness program is led by our workplace wellness director and in partnership with the Bureau for Public Health and WVU Extension. This program leads businesses through the CDC Work at Health training and program implementation. It's a multi-year approach to improve employees' health, covering 18 topics of health. And the interventions are implemented in policy change, environmental upgrades, and systems improvements to enhance each workplace's culture of health. Then we have the Community Captains Program. This is where we have individuals who will lead physical activities on a regular schedule. And I'll explain a little bit more about that on a future slide, but then I want to hop into a little bit more specifically about our Kids Run Club program. And turn that over to India to share a little bit more about the youth programming through Active Southern West Virginia.
Yes, India, thank you. Can you go into some more information about that Kids Run Club? Tell us
Sure
about
thing.
it.
So I'm India, I'm the youth program director with Active Southern West Virginia. And yep, I'd love to share about our Kids Run Club program. So the program started in 2015. We started with one Kids Run Club at Valley Elementary, which had about 25 kids. And since then, the program has grown to reach over 30 schools in West Virginia, which is very exciting. So the Kids Run Club program is a free program designed to get kids active, get kids moving, teach them healthy skills, and increase their confidence in physical activity. So with the program, we run through different activities with kids like warm-up exercises, running, playing some active games, and doing some cool-down stretches through a 6 to 8 week program that's led by volunteers. And throughout the 6 to 8 week program, these kids learn these activities. They learn how to be active, how to be healthy, and again, build their confidence. And these programs culminate in a fun run for kids to celebrate their accomplishments with their school, their friends, their family, and just make it a really fun way and positive way for kids to be active. So
India, can you tell us a little bit about that fun run? What do they do?
Yeah, sure. So each of our individual Kids Run Clubs have their own fun runs. And did you want me to go into the regional fun run at this point, or?
Either, whatever you want to do. Yeah, I mean,
Okay.
You can explain what the fun run is, and then if you want to go into detail, that's
Okay, sounds good. Yeah, so each of our individual Kids Run Clubs culminate in their own individual fun runs. But what we've done over the years is also done a regional fun run to kind of bring all the kids together from all different Kids Run Clubs to one location and do a fun run together. So this year, our regional fun run will be at Woodrow Wilson High School in Beckley, and that'll be on April 30th. And I think I'm going to go into that a little bit more later, but the idea, it's the same idea with the Kids Run Club fun runs, just kind of a culmination, celebration, and kind of a community event to get all the kids together and being active and healthy.
Can you tell us, India, what impact do the Kids Run Clubs have on physical activity with kids?
Sure. So with our Kids Run Clubs, we do pre and post surveys, and these pre and post surveys were designed by the WV School of Public Health. And on these surveys, we ask questions about physical activity levels, screen time, their confidence in physical activity, and things like that. So I just want to read off a couple stats from our 2019 surveys. We do them every year with each of our run clubs in the fall and spring, but 2019 is the most complete set of data we have from the last few years due to COVID. So I'll just reference that one. But one stat is regarding physical activity. The percentage of participants that achieve the recommended 60 minutes of physical activity a day for 7 days a week increased from 29.5% to 35.9%. And that is a statistically significant increase there, which is very exciting. Regarding screen time, by the end of the program, participants' average daily screen time had decreased from 3.64 hours a day to 3.3 hours a day, and that equals about 22 minutes. So again, that's about a 22-minute decrease in screen time from the beginning of the program to the end of the program in the kids that we did survey. Another screen time stat is from the beginning of the program to the end, percentage of participants who met the recommended 2 hours or less of screen time per day increased from 43.4 to 49.7. So again, just more kids decrease their screen time, which is also great. And then a couple additional findings in those surveys we'd like to cite. At the end of the program, 66.2% of participants said that they could definitely be active for the recommended 60 minutes a day, compared with only 60.6 who expressed that at the start of the program. So again, that shows that increase in confidence that kids get for participating in the Kids Run Club. That confidence in knowing they can be active for that 60 minutes a day, that increase from the beginning to the end. And finally, one other stat we'd like to cite is 70.1% of kids indicated that since participating in a Kids Run Club, they have gotten a friend or family member to increase their physical activity as well. And we love to talk about this stat because it's really important to us that not only kids get active and we see that change in kids, but also that kind of transfers to the family at home as well. So, kids are getting active, but that we're also seeing that change in family members with them getting more active too, which is exciting.
Yeah, that is exciting. I know, actually, I worked at Montgomery Pediatrics, which the kids went to Valley Elementary in 2019, and the kids actually talked about the Kids Run Club. Like, they loved it. They had so much fun. But that was really neat that they were excited about it. So how would people get involved with the Kids Run Club, schools get involved?
So right now we have our Kids Run Club mini grant, which is just a way to present the Kids Run Club to schools. And normally the Kids Run Club is kind of geared towards an elementary school age, typically 3rd through 5th graders, but that the program is very flexible and can vary. But we typically recommend elementary age kids are the ones who benefit the most from the Kids Run Club program. So our mini grant is out now. And with our mini grant, I'll go over kind of the benefits of doing that and the requirements of the mini grant. So again, Kids Run Clubs are run by volunteers. So it's one thing you'd have to do is have volunteers ready to start the program and kind of run it through and see it through. But Active Southern West Virginia provides training to those volunteers to kind of present our program and make sure the volunteers feel confident as Kids Run Club coaches, we call them, in administering the program. So one thing we do with the mini grant is we give you a Kids Run Club manual, which is kind of the playbook and guideline for the whole program. It has kind of all the information you need and all the resources and everything to put together practices and just all the content needed for running the clubs. So with the coaches training, we kind of go over that manual, send to schools the actual physical manuals, so they can use those. We also provide t-shirts and medals for all the Kids Run Club participants, which is just a fun way to make kids feel, part of a team, feel like they belong to something. And, kids love free stuff like that. So it's exciting for them. It's a great thing to kind of present on the last day of practice as they're kind of reward also for finishing. And then Active Southern West Virginia also provides technical support, we call it, throughout the season. So as the youth program director, I help each school kind of throughout the season if they have any questions, comments, concerns. I check in with them, make sure everything's going well. Again, send them those shirts and medals, et cetera. And then also with the mini grant, schools to receive $250 to buy healthy items for their Kids Run Club. So that might be physical activity equipment, that might be water coolers. We even encourage like healthy snacks and things like that. And as far as requirements for the mini grant goes, we do ask that all clubs fill out those pre and post surveys with their participants. And again, we just like to collect that data with all our Kids Run Clubs so we can have that kind of, that data, that information to present to partners and funders and share more about the program and its benefits. We ask that clubs are offered for free. So Active Southern West Virginia we offer all of our programs for free as a way to remove that barrier of cost and allow all kids to kind of have access to the opportunity. And that's really, as far as requirements go, it's not too stringent. We really just want to extend the program to as many schools and children as we can. So we make those requirements just pretty much just to be in line with our values, but ultimately the goal is just to get kids active.
Great. Do you have anything to add, Melanie, to that?
Yeah, I'd like to expand a little bit more on the community captain program, and where we have the opportunity with the Kids Run Club program to get kids engaged in after school and with that volunteer facilitator. We also have our community captain program where the family can get engaged together in a multi-generational activity. So we have a staff member here with Active, a community captain director, and this program is partnered with WVU School of Public Health and the Office of Health Services Research for data collection and that clinic community linkage. So for example, in the month of March, we have over 20 weekly programs offered across 7 counties in Southern West Virginia, and those are all connected through West Virginia Health Connection. So those are all available right now today for a physician referral into the community captain program. And examples of those are currently in the month of March, aerobics classes, running groups, walking, biking, yoga, hiking, and we're currently working on programs coming up this spring and summer with the warmer months to include activities like pickleball, water aerobics, disc golf, paddleboarding, and rock climbing. Participants are encouraged to attend these programs on a regular schedule. We want to create those habits of physical activity and build an active lifestyle. They're multi-generational, built for that beginner skill set. And then the community captains help to welcome people into the group, give them information about what that activity is going to be about, also keeping in mind the safety for all of the participants. And while ongoing programming is our goal to have a behavior change and have people adopt a lifestyle of being physically active, we do from time to time do bigger one-day events. And so like India mentioned before, that regional fun run date on April 30th, and many other signature events we'll offer throughout the year, help to pull together more resources and partners to focus on like a one big day event type thing. But ultimately, we want to drive those participants into ongoing programming so they can really truly develop that behavior change and that adopt that lifestyle of being active.
Do you guys have any personal stories or examples of people that had a positive experience with Active's programs?
I can start off with one of our kind of kids run club stories that I like to tell. And it's at Azela Elementary is the school, and they're up in Nicholas County. And most kids run clubs practice after school, but they do their kids run club practices before school. And so they practice for about 3 days a week for about 20 minutes each time in the morning. And during certain times of the year, it's dark out in the morning time. So we tried a couple different things. We gave them little flashlights and headlamps to run with, and some solar lights to try to light up the track, but nothing was quite working. So what we actually ended up doing was the principal reached out to us and asked if we could partner to put up a light to illuminate the track. So we got it done. We worked with the principal, we worked with power company and a few other funders. And I think this was in, I want to say 2019 is when the light got put up. So now there's a floodlight that lights up the track. The kids can run and practice in the morning, and it's also there for evening times, you know, if families or community members want to come and use the track too. So that was just a really nice story about how, you know, the program was so important to these kids and this principal that they wanted to, you know, make it as accessible as possible and get that light put up.
Yeah, I love that you got that the whole community was involved in that decision. Like it wasn't just one person. So that's great. Melanie, do you have anything to share about anything?
Sure. I'll share one other story. It's a little more relatable to the community captain program, but Levi Moore was a participant with us in 2015 and 2016, and he was wheelchair bound for 2 years. And through finding a few different physicians and referrals to physical activity and some changes in medication, he was able to start taking some of his first steps. And he said, wow, I'm noticing this organization and they're doing beginner-friendly activities. I can join them in their walking groups. And so he came out. And then in late 2016, he said, well, I've been able to walk a mile so far. I feel like I can get up and do this on a regular basis, and I want to be a community captain. And so he did, and really became a shining star with getting and inspiring so many other people to be active and pursuing more distances himself. So as he would pursue those longer distances, he would tattoo the little foot imprints on his arm with the distances he was able to accomplish. And in 2019, he was hired by Ace Resort as a climbing guide and is now employed in recreation because of him being able to get back up on his feet and having the support he needed around him. So that's always inspiring. Levi served on our board of directors for a number of years and helped to steer the organization from that perspective, and continues to be an inspiration to many people.
That's awesome. That's a great story. I'll say they did a virtual fall fitness challenge during COVID, and my daughter and I actually participated in it. And it was really fun because it was a scavenger hunt. And then when you found things, you would do certain exercises. So she loved doing it. So like every day she's like, let's go out and do it. It is so much fun. And she loved when she got her little trophy. But yeah, so I love that about active, is that they make it really fun for kids. And, a lot of times it doesn't even feel like we're exercising. And that's really what you want, is that for kids to have fun and they just enjoy it and they don't even realize what they're doing. So it makes it much more enjoyable. So thank you. So I wanted to just go over, we have just a few more minutes before we have to close this session, and I wanted to talk about the benefits of physical activity. So from that article, studies have confirmed that there's a benefit on children's cardiorespiratory fitness, their lipid profiles, insulin sensitivity, and serum glucose concentrations, and that was specifically in individuals with obesity. And they also found associations with more optimal cardiovascular profiles and the most physically active children. So even in children who are already physically active, it helps them. They also talked about that children that do aerobic activity and strength training, they have increased muscle mass and fat mass. It improves bone density and improves balance. They actually also found that it decreased rates of smoking, helped with the symptoms of depression. They found that inactivity and sedentary activity can predict future alcohol and drug use, which, all those things, it's just amazing. Like, we don't really, I think, fully realize sometimes the benefits of physical activity and getting outside. And another thing, it improved the academic performance of people who are physically active. So, there's no doubt that it's something for all of us, and not just our children, but adults. We can be a role model to children to be physically active. So I'm really thankful that Active was able to be on with us and discuss things. So
yeah, of course. All right, everybody, this concludes session A of episode 3. If you're joining us live, don't go anywhere because we're continuing immediately. If you're joining us via podcast, session B of episode 3 is available wherever you listen, whenever you're ready to listen. Welcome to session B of episode 3 of Project Echo for Pediatric Obesity. Now I'll pass it back to our PA and our heyday. Miranda, take it away.
hello, everyone. We're happy you've joined us today with Active Southern West Virginia. We're talking about improving kids' physical activity through prescribing physical activity. So we have Melanie Seiler, who's the Executive Director of Active Southern West Virginia, with us today, and India Krawczyk, who is the Youth Director for Active Southern West Virginia. And we're discussing the programs, their organization, the things that they do. So what we're gonna go into in this section is how families can get involved in the program. So Melanie and India, can you kind of discuss how we can get involved with Active Southern West Virginia?
Yeah, I would be happy to. I'm going to explain a little bit about our Community Captains program, and then I'll turn it over to India to explain more about how we recruit for Kids Run Club coaches and get those families involved. So Active Southern West Virginia, our heart and soul program area is the Community Captains program, where we recruit and train individuals to lead physical activities on a regular schedule. And we want to be able to see those participants come into ongoing sessions of physical activity so that they can truly make that behavior change and adopt that active lifestyle. So currently, for example, in the month of March, we have over 20 weekly physical activity programs offered across 7 counties. And those are activities such as running, biking, aerobics, yoga, and coming up in the warmer months, we'll have activities like pickleball and water aerobics and paddleboarding and rock climbing. So
Melanie, do you know can you tell us what specific counties you're in?
We're expanding. So first, in our first 4 years, we were in Nicholas, Raleigh, Fayette, and Summers counties. Last year, we adopted Boone and Kanawha, and now through partnership with the Bureau for Public Health and WVU Extension, we're opening across the state.
Great.
So we are looking for that expansion, definitely on an organic grassroots level. We are very much programming on the ground and in the parks and at the schools, and recruiting volunteers in the smallest of small communities. It's our goal to break down those barriers to access. And a lot of the time that's a geographic location and transportation. So recruiting individuals who reside in those small communities who can be that healthy mentor for their immediate family, friends, and neighbors is where we feel we are able to make the impact and see people change their lifestyles. So let me tell everyone where they can find more information about the Community Captain Program. We pride ourselves on the content in our website. We do get in there add to that website on a daily basis. So activeswv.org. And we have a website calendar. That website calendar is the home base of all of our activities. And that schedule is kept up to date 24/7. So the Community Captains programs are listed on the website calendar. But also for family and multi-generational involvement in programs through our Youth Kids Run Club program, there's opportunity for adults to engage there as well.
Yeah, so a lot of our Kids Run Clubs, most of our Kids Run Clubs have some, participation from parents and adults. So all our Kids Run Clubs are led by volunteers, and usually that means volunteers at the school that they take place at. So that's teachers, faculty members, et cetera. But we also really like to encourage parent involvement. In quite a few of our clubs, like I said, do have parents or adults or grandparents as those coaches who lead the program as well, which is really exciting to see. And the way we recruit for that is, typically the way Kids Run Clubs start are oftentimes either the school reaches out to us or even a parent reaches out to us and say, we want to have this program at the school. What do we do to get it started? And through that process, we find others who are interested. A parent might have some friends who might want to participate too and have their kids involved. Teachers might have some good relationships with some parents who want to participate too. So it's a really great way to get the community involved in the program as well, and not just have it solely at the school. It has that kind of parent involvement, community involvement as well. And like I said it before, with that stat about getting kids active at or kids saying that they got a friend or family member active at home, it's really great to see that that happening kind of organically, just with parents and other adults as Kids Run Club coaches, bringing their kids in and kind of vice versa, introducing the program to each audience. We also encourage at the fun run for every Kids Run Club, which is kind of the culmination reward event for those individual clubs. We do encourage parents, adults, grandparents, friends, family, et cetera, to come and participate in the fun run as well. So again, just that parent involvement, that community aspect is really important to the program too.
When does the Kids Run Club start? You may have said that, but I can't remember if we did.
Yeah, so Kids Run Clubs, typically we do 2 sessions a year. We have our spring Kids Run Clubs and our fall Kids Run Clubs. And the schedules for each individual club is completely set by the volunteers. We recommend that it's 6 to 8 weeks, and usually kind of the 6 to 8 weeks is whatever the best weather for that time of year is. So right now we're kind of rolling into our spring Kids Run Clubs, and those will typically start end of March, beginning of April, and kind of run through May to the end of the school year. Our fall Kids Run Clubs typically start usually September, and usually they wrap up around the end of October, but there's a little variation there, just again, depending on the schedule of the volunteers who run the club, and depending on what the best weather window is for that time of year.
Great. Do you have anything to add?
I also noticed in the chat, there's a comment asking about liability in our programs, and maybe I can provide a little context, and it might've been a direct message, but some context around the structure, the organization, and the facilitation of the programs. So we do carry a large insurance policy with the organization and liability waivers. So with the community captain program, every participant is asked to sign a release of liability. And every site that we have a location for a program, we are additionally insuring that site. Oftentimes that venue partner wants to have that additional coverage should anyone get hurt on their property or there be an issue. Each of the community captains go through a community captain training. They sign a pledge of how long they're going to volunteer with us and that they agree to our guiding principles. And those guiding principles are around the characteristics of being welcoming and inclusive, not to speak about body image or having a competitive atmosphere, that we have a friendly, welcoming environment for our participants to come into. And then also with the Kids Run Club programs, some of the structure there, we are additionally ensuring the school locations where the clubs are taking place, providing background checks when those are necessary for Run Club coaches, and doing permission forms and photo releases for each of the children that are in the club. So there's a little bit of behind the scenes in the administration of the programs to make sure that everyone's protected who is participating, and data is collected as well. So we want to see where our impacts are, our participation levels, our frequency of participation, if we're getting some behavior change, and ultimately if we can get more physician referrals and being able to share electronic medical records and reports, we'll be able to see health outcomes based on the frequency of participation.
That's great. Do you guys, we have a little bit of extra time, so I think let's go over what programs for adults do you offer. We talked about the Kids Run Club, but specifically, are there some programs that are more geared towards adults that people who see adult patients could get involved with?
Yes, those are the community captain programs. Those are all listed on the website calendar and also with West Virginia Health Connection. So viewing the West Virginia Health Connection map and clicking into physical activity programs, that's can create a direct referral to our activities. Also through West Virginia Health Connection, if a patient isn't sure of what type of activity they may be interested in, you can populate a referral that will prompt us to contact that patient and share with them what we have going on or what's coming up, and try to guide them and steer them into a location that works for them and an activity type that they're comfortable with approaching.
Okay, great. Sounds good. I wanted to discuss a little bit about the provider's role in this. So, we, as providers, they play a critical role in encouraging physical activity. And so from that article that I've been discussing, they gave specific things that providers could do. So the first thing is assessing current physical activity. So we obviously have to know if our kids are being physically active to know how to tell them to be active. So they also talked about providing guidance regarding the recommendation. So we have to let our children and families know what the physical activity recommendation is, that they get 60 minutes of physical activity every day. And then they recommended to set a goal with the child and to use motivational interviewing with that, so that we set this goal. And then they did recommend writing a prescription and connecting that prescription to community resources. And that's something that Keys for Healthy Kids has started doing. So we have a program that we do called the 5210 prescription program. And we're doing it with providers and practices where we have quarterly themes that they prescribe different things based off of the 5210. And one of those themes is physical activity. So during specific months, it's November to February, we have them actually prescribe a physical activity prescription. And so they work with the patient and they pick a goal of how much physical activity they're going to get. And so that's something we before we actually even work with the providers, we train them in obesity management and prevention. And so we'll have on the slides a picture, what we sent this podcast out. You'll get to see a picture of that physical activity prescription. Now, there are other places where you can do physical activity prescriptions. So there's a program called Exercise is Medicine that they do a lot with adults as well. And a lot of fitness centers will work with some providers to do the exercise as medicine. So there are definitely ways that even family practice and other providers can prescribe physical activity prescriptions. The other thing that they talked about was addressing barriers with children with special healthcare needs. So that's an important thing because, again, we talked about those are the kids that a lot of times aren't getting as much physical activity as what they should. And then you want to advocate for physical activity opportunities for children in schools, communities, and hospitals. So, and that's what Active is wonderful about doing that, about creating those opportunities, because if we prescribe physical activity and our kids don't have anywhere to go, then there's not a point to that. So that's the important thing, is really making sure that they're able to exercise. And we were talking about, there are some barriers with kids. Some kids don't live in safe areas where they can exercise. So it's really important with your patients finding out, what their barriers are, and then helping them to figure out what ways that they can still have physical activity. And that's really why we focused our quarterly theme of physical activity during winter months, because it's a lot harder in the winter for kids to be active because it's colder. And then another important thing is modeling physical activity. So I talked about that a little bit, but making sure that as providers, families, adults, we're, a lot of us are parents, modeling our physical activity. And that's something that I think is really hard with everybody being busy. It's really hard to be physically active. But again, we've talked about there are so many benefits of it. So if we can be a role model for our families. And then they talked about advocating for assessment tools. So, being able to assess whether or not they're physically active. And we do that through the 5210 Healthy Habits questionnaire. And it actually asks them how many times they're physically active during a day or during a week. And then advocating for insurance coverage of physical activity and physical literacy screening, which I think that is something now that they do reimburse for if you use the code for exercise counseling. But that's something that helps providers is, being incentivized for that. And then you want to incorporate physical activity assessment and prescription and medical school curriculum. So they're really talking about medical schools also focusing on prescribing physical activity and starting to teach about it so that it becomes something that we just do. So those are all important ways of pushing physical activity for our kids. We really appreciate Melanie and India being on. Thank you for sharing. Everything they do is really awesome. They actually do you guys want to talk about what you do in Fayette County with Adventure Fayette County? Do you want to go into that a little bit? That's something that we've helped with some, but yeah, maybe talk about that because I know that's coming up.
Yeah, I could definitely talk about that a little bit. So Adventure Fayette County is a coalition of different organizations in the area who come together to provide event opportunities for kids to get active, be healthy in different ways. So it's under the umbrella of the Fayette Prevention Coalition. So these initiatives that we do are part of an effort to, reduce drug use in kids and as a prevention measure to make sure kids don't get into those kinds of activities. But an upcoming event we have going on is called Project Adventure, and it's going to be at the Fayette County Park. And it's going to be a really cool field trip for 4th and 5th graders in Fayette County. And the way it works is all the kids get bused there. We provide a meal too from the schools. But once the kids get there, they get to kind of get a survey of a bunch of different organizations and activities and things that they can do in their own community. So Active Southern West Virginia will be there. We'll have a little obstacle course set up for kids. There are going to be some folks there doing fishing with kids, introduction to paddleboarding, kayaking. Camp Royal is going to be there with some of their scooters and bikes and things like that, doing a demonstration. There will be churches doing presentations on their vacation Bible schools and things like that. Different activities that kids have the opportunity to join. Trying to think of some of the other presenters who will be there, but the bottom line is it's going to be all kinds of different activities kids can kind of get a sample of throughout the day. And then when they go back to school, we're going to give a survey to the kids and see, what was their favorite thing that they saw? Have they ever experienced it before? And do they think they're going to be able to pursue that activity? So say they really enjoyed kayaking or something. And so we want to know that that's something they're interested in. We want to find ways to make that accessible for them in the future. So it's just a really great way to get kids introduced to these activities, show them there's more to, their free time than just, playing on their phone or getting into drugs and alcohol or something like that. So the idea is really just to get kids engaged in these different activities. So it's a really cool really cool way to do that.
Are they going to be weren't they doing something in Smithers like every 2 weeks or once a month or?
Yeah, so that's Adventure Days over the summer. And again, it's the same group of organizations, and it's not quite as extensive as that Project Adventure, but the way Adventure Days works is different organizations come to different locations, such as Smithers. We did some in Fayetteville and some in Oak Hill. But they just set up little activities for kids for about like a 2 or 3 hour block, I think it is. So we've provided an obstacle course in the past. I think there was kind of bubble making, things like that, some painting. I'm forgetting some of the other activities there were, but again, it's kind of a mini sampler of that bigger Project Adventure, but it's a traveling kind of opportunity. So where Project Adventure is going to be just those 2 days for those kids at the Fayette County Park, this Project Adventure, Adventure Days that happens over the summertime, is, it travels. So different kids in different areas can experience, a little sampling of those activities too. So it's been really cool to do that.
I think they provided them lunch too, didn't they?
Yes, they did. That's right.
Yeah, which was nice.
In addition to the adult programming with community captains, we also have our workplace wellness program, and that helps to facilitate businesses to change a culture of health, and partnered with the State Department of Health and WVU Extension. We have a workplace wellness director on staff who takes employees from businesses through the CDC Work at Health training. And that sets a foundation for assessing, planning, implementing, and evaluating a multi-year approach at workplace wellness. And we're really excited. This will be the 3rd year of offering mini grants, capacity building grants to support businesses to complete that training. So as they develop a 1-year action plan and multi-year action plans, there's some funding that can also go in to support the equipment or incentives or supplies that they need to put those changes into place. And those are interventions that are made in policy change, environmental upgrades, or systems improvements that can make the healthy choice the easy choice when you're at work. And what we see across our organization, the ecosystem of our organization, is that we can have youth programming at schools, community captains on the community level, and then workplace wellness in the businesses. And so we're helping to touch people at all those points in their day-to-day lives. And we see crossover. We'll see individuals who have participated in a workplace wellness program and say, oh, I'm just noticing now you have that Kids Run Club program. My daughter's elementary school really needs that, and I'll help to volunteer to make that happen. Or there'll be a workplace wellness group, and then they'll branch out and say, well, we're going to start a walking group after work, and I'm going to invite more of my friends to come to that. And so we're building layers upon layers with the programming and reaching people where they're at with the resources to continue the programs. And I think it was mentioned too in the first half about some of the challenges to West Virginia having access to safe places for physical activity and the inequities in access. And so I'm excited to join in partner projects and pool funding together that can help community projects break down those barriers to accessing safe places for physical activity. So we're looking at projects in Hinton for a green space, in Clay County and McDowell County. Raleigh County, the city of Beckley, is working on a large plan for recreation that's focused at the residents having access to that recreation. So as we all know, West Virginia is a great tourism destination, but we want it to also be welcoming for the residents to engage in their backyard and their outdoor access and to know where those trailheads are. So sometimes that's the only barrier is somebody's not aware that they have a trailhead very close to their school, work, or home. And so there's lots of things going on. I'm very excited about this time in West Virginia around public health and the ways that we can reach people in all the places and all the spaces, and how helping children helps everyone. So I appreciate the efforts of all the partners and the opportunity to grow.
Yes, I think that's a big thing, is like us at our workplaces being healthy, because it's hard. We spend, we're so busy, and so sometimes we let that go by the wayside. So I think workplace wellness is really important. So yeah, I'm glad you mentioned that.
in our office. That's why I'm here to say, you guys want to go for a walk? We should go for
That's
a walk.
right. Yes, Jesse's really good about that, making us take walks. And so I was going to say next in April, we're actually going to be talking about fatty liver disease. We're going to have Amy Gannon, a dietitian who knows a lot about that, talking, and Dr. Jeffrey is going to be talking with her as well about fatty liver. So.
All right. Thank you, everybody, for joining us today for episode 3. And thank you so much, ladies from Active Southern West Virginia. That was extremely informative. And I'm looking forward to partnering with you all in the future. I will be emailing you shortly about Clay County. All right.
5, 2, 1, 0. Every kid, every day. Let's have fun the healthy way. 1, 2, 3, 4, 5 servings of fruit and veggies are great to eat. 1, 2 hours of playtime or less on our screens is more than plenty. And let's go play outside. 1 hour. Tiger it. My turn to hide. 0 sugary drinks. Yeah, that's the healthy way to